What is Ganciclovir used for? If you're searching for answers, you've come to the right place. In this video, we will delve into the typical uses, recommended dosage, potential side effects, and user opinions of this powerful antiviral medication. Ganciclovir is commonly prescribed for the treatment of viral infections caused by the herpes simplex virus, HSV, and cytomegalovirus, CMV. Whether you're dealing with recurrent genital herpes, severe infections in immunocompromised patients, or CMV retinitis in individuals with AIDS, understanding how Ganciclovir can be used effectively is critical. We will explore the recommended dosage and guidelines for various conditions, ensuring you have the necessary information to make informed decisions regarding your treatment. As with any medication, it's important to be aware of potential side effects. We will cover common and rare adverse reactions associated with Ganciclovir, helping you weigh the benefits against the risks. Additionally, we will provide insights from individuals who have used Ganciclovir, offering valuable user opinions and experiences. Let's dive in and explore the world of Ganciclovir, understanding its uses, dosage, side effects, and real-life perspectives. Typical uses of Ganciclovir. Ganciclovir is a potent antiviral medication that is commonly used to treat viral infections caused by the herpes simplex virus, HSV, and cytomegalovirus, CMV. These infections can range from recurrent genital herpes to severe infections in immunocompromised patients. Ganciclovir is also effective in treating CMV retinitis, a serious eye infection that primarily affects individuals with AIDS. The primary use of Ganciclovir is in the treatment of CMV infections. CMV is a widespread virus that can cause severe complications in individuals with weakened immune systems, such as those with AIDS or who have undergone organ transplantation. Ganciclovir works by inhibiting the replication of the CMV virus, helping to control the infection and prevent further damage. In addition to CMV infections, Ganciclovir is also used in the treatment of recurrent genital herpes. Genital herpes is a sexually transmitted infection caused by the herpes simplex virus type 2, HSV2. Ganciclovir helps to reduce the severity and duration of genital herpes outbreaks, providing relief to individuals affected by this condition. Ganciclovir is typically administered intravenously, but it is also available in oral and ophthalmic formulations for certain conditions. The dosage and duration of treatment may vary depending on the specific infection and the individual's response to the medication. It is important to follow the prescribed dosage and treatment regimen as advised by a healthcare professional. Recommended dosage of Ganciclovir. The recommended dosage of Ganciclovir varies depending on the specific condition being treated. For CMV infections in immunocompromised patients, the usual dosage is 5 mg per kilogram of body weight administered intravenously every 12 hours for 14 to 21 days. The dosage may be adjusted based on the individual's renal function. For the treatment of CMV retinitis, Ganciclovir can be administered through intravenous infusion or intravitreal injection. The dosage and frequency of administration will be determined by an ophthalmologist based on the severity of the infection and the individual's response to treatment. For recurrent genital herpes, Ganciclovir can be administered orally. The recommended dosage is 1 gram twice daily for 5 days, starting at the first sign of an outbreak. The medication should be taken with food to improve absorption and reduce the risk of gastrointestinal side effects. It is important to note that the dosage of Ganciclovir may need to be adjusted in individuals with impaired renal function. A healthcare professional will assess the individual's renal function and determine the appropriate dosage to ensure optimal treatment efficacy and minimize the risk of adverse effects. Potential side effects of Ganciclovir. Like any medication, Ganciclovir can cause side effects. The most common side effects include nausea, vomiting, diarrhea, and headache. These side effects are generally mild and temporary, and they often improve as the body adjusts to the medication. It is recommended to take Ganciclovir with food to help reduce gastrointestinal side effects. More serious side effects of Ganciclovir can include bone marrow suppression, which may manifest as anemia, leukopenia, low white blood cell count, or thrombocytopenia, low platelet count. Regular blood tests may be necessary to monitor blood cell counts during treatment with Ganciclovir. Ganciclovir can also affect kidney function, leading to renal impairment. It is important to monitor renal function regularly, especially in individuals with pre-existing kidney disease or those receiving high doses of Ganciclovir. If kidney function deteriorates, dosage adjustments or discontinuation of Ganciclovir may be necessary. Other potential side effects of Ganciclovir include fever, rash, dizziness, and confusion. In rare cases, Ganciclovir can cause serious allergic reactions or liver toxicity. If any severe or persistent side effects occur, it is important to seek medical attention immediately. User opinions and experiences with Ganciclovir. User opinions and experiences with Ganciclovir can provide valuable insights into the effectiveness and tolerability of the medication. While individual experiences may vary, hearing from others who have used Ganciclovir can help individuals make informed decisions about their treatment. Many users have reported positive experiences with Ganciclovir in the treatment of CMV infections and CMV retinitis. They have found the medication effective in controlling the viral replication and managing the symptoms associated with these conditions. Users have also appreciated the convenience of intravenous administration and the flexibility of treatment options available. In the case of recurrent genital herpes, users have reported mixed experiences with Ganciclovir. While some have found the medication effective in reducing the frequency and severity of outbreaks, others have experienced minimal improvement or recurrent outbreaks despite treatment. It is important to note that individual responses to antiviral medications can vary, and what works for one person may not work for another. When considering user opinions and experiences, it is essential to remember that these are subjective and may not reflect the overall efficacy or safety of the medication. It is always recommended to consult with a healthcare professional to determine the most appropriate treatment plan based on individual circumstances. Alternative treatments for the same conditions. In addition to Ganciclovir, there are alternative treatments available for the conditions it is commonly used to treat. For CMV infections, other antiviral medications, such as Ganciclovir or foscarnet, may be prescribed depending on the individual's specific needs and circumstances. These medications work by targeting the CMV virus and inhibiting its replication. For recurrent genital herpes, antiviral medications like acyclovir or valacyclovir are commonly prescribed. These medications can help reduce the frequency and severity of outbreaks and provide relief from symptoms. It is important to discuss the available treatment options with a healthcare professional to determine the most suitable approach for individual needs. In the case of CMV retinitis, other treatment options include intravitreal injections of antiviral medications, such as fomivir-sen or cidofovir. These medications are directly injected into the eye to target the infection and prevent further damage to the retina. Surgical interventions may also be necessary in some cases to manage the complications associated with CMV retinitis. The choice of treatment will depend on various factors, including the specific condition, the individual's overall health, and their response to previous treatments. A healthcare professional will assess the individual's needs and recommend the most appropriate treatment plan. Precautions and warnings for Ganciclovir use. Before initiating treatment with Ganciclovir, it is important to consider certain precautions and warnings. Ganciclovir should not be used in individuals who are allergic to the medication or its components. A healthcare professional should be informed of any known allergies or hypersensitivity reactions. Ganciclovir can cause birth defects and should not be used during pregnancy unless the potential benefits outweigh the risks. Adequate contraception should be used during treatment with Ganciclovir to prevent pregnancy. If pregnancy occurs during treatment or within 30 days after discontinuation of Ganciclovir, a healthcare professional should be consulted. It is also important to note that Ganciclovir can affect fertility in both males and females. Individuals planning to have children in the future should discuss the potential impact of Ganciclovir on fertility with a healthcare professional. Ganciclovir may interact with other medications, including certain antiviral drugs, immunosuppressants, and medications that affect kidney function. It is important to provide a complete list of all medications, including over-the-counter drugs and herbal supplements, to the healthcare professional before starting Ganciclovir. Interaction with other medications. Ganciclovir has the potential to interact with other medications, which can affect its efficacy or increase the risk of side effects. Some medications that may interact with Ganciclovir include antiviral drugs. Combining Ganciclovir with other antiviral medications, such as zidovudine or didanosine, may increase the risk of bone marrow suppression and kidney toxicity. Close monitoring of blood cell counts and renal function is essential when using these medications together. Immunosuppressants. Ganciclovir can interact with immunosuppressant medications, such as cyclosporin or tacrolimus, which are commonly used in organ transplantation. The combination of these medications can increase the risk of kidney toxicity. Regular monitoring of kidney function is necessary when using Ganciclovir with immunosuppressants. Medications affecting kidney function. Ganciclovir can affect kidney function, and combining it with other medications that also affect the kidneys, such as nonsteroidal anti-inflammatory drugs, NSAIDs, or certain antibiotics, may increase the risk of kidney damage. Healthcare professionals should be informed of all medications being taken to monitor kidney function closely. It is important to discuss all medications being taken with a healthcare professional before starting Ganciclovir to minimize the risk of potential interactions and ensure the safe and effective use of the medication. How to store Ganciclovir properly. Proper storage of Ganciclovir is important to maintain its effectiveness and safety. Ganciclovir should be stored at room temperature, away from heat, moisture, and direct light. It should also be kept out of the reach of children and pets. The medication should not be frozen. Ganciclovir should be stored in its original packaging, with the container tightly closed. If the medication is provided as a powder for reconstitution, it should be prepared according to the instructions provided by the manufacturer or healthcare professional. Unused Ganciclovir solution should be discarded after the prescribed duration of use. It is important not to keep or reuse any leftover medication unless instructed to do so by a healthcare professional. If there are any concerns or questions regarding the storage or use of Ganciclovir, it is recommended to consult with a healthcare professional or pharmacist for guidance. Conclusion. Ganciclovir is a powerful antiviral medication commonly used for the treatment of viral infections caused by HSV and CMV. It is effective in managing conditions such as CMV infections, CMV retinitis, and recurrent genital herpes. The recommended dosage and duration of treatment may vary depending on the specific condition and individual response. While Ganciclovir can be an effective treatment option, it is important to be aware of potential side effects, including gastrointestinal symptoms, bone marrow suppression, and kidney impairment. Regular monitoring of blood cell counts and renal function is necessary during treatment with Ganciclovir. User opinions and experiences can provide valuable insights into the effectiveness and tolerability of Ganciclovir. However, individual responses to antiviral medications can vary, and it is recommended to consult with a healthcare professional to determine the most appropriate treatment plan. Alternative treatments may be available for the conditions Ganciclovir is used to treat, and the choice of treatment will depend on individual circumstances and preferences. Precautions and warnings should be considered before starting Ganciclovir, and potential interactions with other medications should be discussed with a healthcare professional. Proper storage of Ganciclovir is essential to maintain its effectiveness and safety. Following the recommended storage guidelines will help ensure the medication remains suitable for use. In conclusion, Ganciclovir is a valuable medication in the treatment of viral infections, and understanding its uses, dosage, side effects, and user opinions can help individuals make informed decisions about their treatment and overall well-being.